All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about toll-like receptors 2 and 6. Particularly, we'll be talking about an example that can activate these toll-like receptors 2 and 6. And then we'll see what happens afterwards. Okay, so again, let's just refresh the fact that toll-like receptors 2 and 6 are on the cell surface, okay, of certain white blood cells like dendritic cells and macrophages, for example. But in this case, we'll be talking about macrophages since in our previous videos, when talking about toll-like receptors, we've been using macrophages as our example. Okay, so toll-like receptors 2 and 6 respond to something called zymosin. All right, zymosin. And zymosin is a fungal cell wall component. Okay, a fungal cell wall component. All right, so we'll see how this plays out when we talk about our example in this video, which is going to be Candida albicans. Okay, so we're going to be talking about Candida albicans. All right, so let's say we have our oral mucosa, right? And Candida albicans enters the oral mucosa. Okay, so let's say if we draw the Candida albicans like this, right? And then let's highlight the cell wall. Let's say this is the cell wall. All right. So let's actually draw that better. We'll distinguish it like this. So let's say this is cell wall, right? Surrounding the Candida, or which is obviously a fungus, right? And then on the cell wall, or actually a part of the cell wall, right? A component of it is zymosin. Okay, so let's say these green dots is a component of this fungal cell wall, and this represents zymosin. All right. So what happens is once Candida enters, right? Let's say your oral mucosa in this case, like we're going to have white blood cells, right? So let's say it encounters a macrophage. What fungus can do is, right, especially in this case, is it's going to release the zymosin, okay? It's going to release the zymosin. Now, when that happens, remember we said toll-like receptors 2 and 6 recognize the zymosin. Okay, and if we have macrophages there, right, in our oral mucosa, that's going to recognize it. That's perfect, right? So let's say we have a toll-like receptor 2 like that, and a toll-like receptor 6 like that. Okay, so let's say this is toll-like receptor 2, and this orange one's toll-like receptor 6. All right, so let's say zymosin is this green color, right, that we drew. So if zymosin binds to toll-like receptors 2 and 6, it's going to lead to the dimerization of toll-like receptors 2 and 6. Okay, so we're going to have our macrophage here, right? That's our nucleus. And I'm going to represent the dimerization like this. So this is going to be toll-like receptor 2, and then it's going to be dimerized, forming a heterodimer, right, with toll-like receptor 6. So that's toll-like receptor 6 is toll-like receptor 2. Perfect, right? So zymosin will get released from the fungus, in this case, Candida albicans. It's going to bind toll-like receptors 2 and 6, leading to the dimerization of 2 and 6, right? Toll-like receptors 2 and 6. Then that means once toll-like receptors 2 and 6 dimerize, they get activated. Once activated, as we know from previous videos, we get the activation of intracellular pathway, specifically MyD88. Then MyD88 will go and activate nuclear factor kappa B. Nuclear factor kappa B. Nuclear factor kappa B will go in the nucleus of the macrophage, induce gene expression, which will lead to the release of cytokines, right? So, like interleukin 1, interleukin 6, interleukin 8, right? All these cytokines, tumor necrotic factor alpha, TNF alpha. But a main thing that we should focus on is when nuclear factor kappa B, in this case, goes to the nucleus, of course, gene expression will get induced and you're going to release cytokines. A major cytokine would be, in this case, interleukin 6, right? Which we said already up here. But what interleukin 6 does as we're familiar with from immunology, right, is that it can go to your naive T cells. So let's say this is your naive T cell. Let's also change up the color, right? Let's say this is your naive T cell. Yeah, so your naive CD4 cell, right? Interleukin 6 can stimulate the naive CD4 cell to turn into the Th17 subtype. Now we know that the Th17 subtype will then release IL-17, and then IL-17 will attract neutrophils. Okay, so the neutrophils will come in and try to take care of this fungus, right? So it's going to try to attack the Candida in this scenario. So again, we can see the importance of toll-like receptors 2 and 6, right? If there's some defect in this, like let's say for example, if we talk about the clinical relevance relating to HIV or AIDS, for example, patients who have HIV and AIDS, we know that it decreases their lymphocyte count, their T lymphocytes. In this case, if we talk about the T lymphocytes, right? AIDS, HIV and AIDS patients will have low Th17 cells. If you have low Th17 cells, right, then you're not going to be able to attract as many neutrophils to the area, like especially if you get a fungal infection like Candida. So that's why HIV patients or immunodeficient patients, right, are have an increased chance of Candida infections. Okay, but the main focus of this video is knowing how toll-like receptors 2 and 6 work and how, for example, fungal or fungus can activate toll-like receptors 2 and 6 and what that leads to and what cytokines that leads to also, the production of cytokines. So that was it for this video. I hope it wasn't too confusing. I hope this made sense. I hope you guys learned a little bit. And thanks for watching, and I hope to see you guys in my future videos.